for health.
There is plight in having a newborn baby for every family. However, sometimes things may not go as expected. There is about 1 in every 20 children living with disability of different forms, and some of them may not grow to their full potential, to their full capacity. Now, some children may fail to attain milestones as anticipated. For example, a child may be expected to sit at 4 to 5 months of their age, to crawl at about their 9 months of age, to walk at about their 1 year of age, and so many other anticipated milestones. But sometimes these children may not achieve their milestones on time due to different causes. Today on the Pediatric Voice, we discuss cerebral palsy, a condition which is the most common cause, one of the most common causes of motor disability in children. One of the reasons as to why a child may fail to attain their milestones. It is October, and it is the 4th of October of 2023. You are watching the Pediatric Voice. And on the 6th of October, that is just 2 days away from today, we shall be celebrating the World Cerebral Palsy Day. And on this day, they aim to look at different stakeholders. What best can they do to improve the livelihood of children that are living with cerebral palsy? It involves the families, the children, the health workers, the social workers, psychologists, and so many other parties that are involved. So that drove us to discuss cerebral palsy. We are going to discuss what is cerebral palsy, what really brings this devastating condition, what can be done about it, how can we, is it really preventable? What can we do about it? Welcome to the Pediatric Voice. I'm your host, Dr. Helen Namsoke. You are watching the Pediatric Voice, your weekly Wednesday plot, where we discuss different childhood illnesses and so many other things. But first, let's have the documentary.
Reflexes, posture and balance. It is usually caused by adversaries to the growing brain, which may happen in utero, during birth and early life of the child. The prevalence of cerebral palsy is 2 to 4 cases per 1,000 live births and is the most common cause of motor dysfunction in children. Globally, it is associated with a huge economic burden of about $9.3 billion, with 80% of costs attributable to indirect costs of reduced productivity. Children living in the rural areas having 25 times higher chances of premature death. Therefore, compounded efforts to prevent damage to a growing brain would reduce childhood morbidity and mortality, as well as improve productivity of the nation.
Thank you for watching the Pediatric Voice and keeping it at Bethany TV for Health. Today we are discussing cerebral palsy and the different aspects of cerebral palsy. This is in anticipation of the World Cerebral Palsy Day that is to happen on the 6th of October of 2023. And the theme for this year is to improve care for the children that are living with cerebral palsy using a multi-sectorial approach. That is, use of different people, that is the dietitian, nutritionist, the psychologist, social worker, family, as well as the different health workers. Today in our studio, we have an interesting guest who's a neurologist and is going to take us through the different aspects of cerebral palsy. Let's look at his profile.
Epilepsy Training 2021, Ugandan faculty. Dr. Sebunya Robert Kabuye, a pediatrician and pediatric neurologist at St. Francis Hospital in Zambia. He trained at Mbara University of Science and Technology, Makerere University, Red Cross Children's War Memorial Health South Africa, and University of Cape Town, South Africa. He has an 11-year experience in childcare and is passionate about taking care of children living with neurological conditions. He is an honorary lecturer at Mother Kevin Postgraduate Medical School, Uganda Matters University in Kozi, as well as Makerere University College of Health Sciences. He is a winner of several accolades, that is, the Sheila Wallace Award 2024, the prestigious De Souza Bernard 2021 Fellowship Award, the current Young African Child Neurology Society representative to the International Collaborative Body, the Pan-African Epilepsy Training 2021, Ugandan Faculty of June 2021. He is a mentor in pediatric neurology care as well as a facilitator for the pediatric epilepsy training.
Welcome to the show, Doctor.
Thank you very much, Helen, and thank you very much for the kind introduction.
Thank you, Doctor. So our viewers out there would want to learn from you. Disclaimer, Dr. Sebunya is my lecturer. He trained me a lot of pediatrics during my medical school days, and I'm so excited to host you, sir.
Thank you very much, Helen.
And our viewers out there are so waiting to listen and learn from you, especially about cerebral palsy. As you can see, it is very common, and almost every family may be having someone they know, either a relative or a neighbor or a friend that has a child or an adolescent that is living with cerebral palsy. But as before we dive into the discussion, you've seen the documentary. What's your comment about it?
Wow. Thank you for, once again, I say good evening, viewers, and thank you very much for this opportunity to come and speak to cerebral palsy. Yes, I'm a neurologist, and it kind of humbles me to come and speak to my people, or I call my fellow countrymen, regarding this devastating condition, and hopefully we can diverge into some of the aspects of cerebral palsy and see how we can help. Yeah.
Okay, but before we dive into the discussion, what is this thing called cerebral palsy?
Wow. So cerebral palsy, it's one of the commonest neurological condition, and it's a chronic neurological condition.
And where neurological you mean?
Neurological, I would mean a problem with the brain.
Okay.
Yeah, neurology, and that's you're
brain
talking
and
to
the
brain
spinal cord.
and the spinal cord. So that is cerebral palsy. And by definition, it's a disorder of movement and posture, which emanates from a non-progressive insult, causing activity limitation. And this occurred due to a disorder that happened to an immature or fetal brain. And as such, because it's a disorder of movement and posture, the motor component is usually accompanied by other comorbidities like epilepsy, cognitive impairment, visual impairment, visual I mean seeing and issues of seeing.
My mother out there would want to understand what is this thing motor component.
So motor component, you would really put it in the way one movement is.
Movement issues.
Movement issues is
okay.
Motor is the kind of, could say, motor component, movement.
Okay.
So what cerebral palsy does will impede you, will prevent you from moving the way you want to move. If I want to put this hand this way, at times I may not be able to do as I wish. All right.
Okay. Thank you very much. Maybe to our viewers out there, the brain is the body part that controls all your activities. So in case you have an insult or a damage to your brain, that means depending on the part of the brain that is affected, you're likely to have issues with activities that are supposed to be done by that part. So from his definition, I'm getting it that there is a brain that is still growing.
True.
And then this brain gets an insult or a damage somewhere.
Perfect.
And this can be fetal, that is while the baby is still in the womb.
Yes.
Or the baby is already born and the brain is not yet mature, so an insult happens, so the damage happens. Is it reversible or irreversible?
Most of the time it's irreversible.
So it is an irreversible damage to the brain.
Yes.
So, and it affects the body activities because the brain controls the activities of the brain.
Yes.
Hope I've made it as
you've made it as simpler as possible.
So when it affects the activities, so it means there will be complications in the different day-to-day activities of that particular child, right?
Yes. Right.
Thank you very much. Is it that common? And how common is it?
Yes, cerebral palsy, actually, like I said, it's one of the most common disorders of the brain, chronic disorders of the brain, which we call neurological disorders. And worldwide, yes, it is common. They will give you prevalences, say, of 2.5 for every high income countries, 2.5 per
1,000 live births.
1,000 live births. But even as here, our country home, Uganda, we are not far from that. And actually, there is some work that is going on. There is a study, very comprehensive research study that is going on called the CURI, and that is occurring in Iganga and Mayuge. And it's a surveillance kind of research site, and it's looking at the epidemiology of cerebral palsy in our setting, Uganda.
So they are, is it, do they do day-to-door, or they look at home hospital visit and see how many are coming in?
They are doing all that.
Okay.
And they are reporting some preliminary data that is coming through, speaks to the fact that we are having about 2.7 to actually 5.8 per 1,000 live births. So contrary to what is happening in the Western world.
Wait, it's about, some countries report 1.8
yes,
to 2.3.
For us, we can go as far as 5.8. And that's what the data is, which is coming through.
So we are times 3.
Perfect.
Their numbers.
Yes.
Okay. How would one know that a child is living with cerebral palsy?
So,
what are those features?
So the features of cerebral palsy would be, and it will depend on, some may come in and tell you, say, doctor, I delivered and my child never cried immediately. So you need some bit of history that is coming through. We'll have two types. We'll have those ones who will tell you that something really happened, and when you take history, it happened, and there are some who tell you that nothing happened, but they'll come in either unable to walk or using being not able to achieve their milestones. Like you rightly said that as a preamble that you gave with regarding this cerebral palsy. So many will come in and tell you, my child has failed to walk. My child can't crawl. His child is supposed to be talking, he's not talking. He can't use this side. He is not seeing, I don't know whether he's seeing. And even some may just come in with the convulsions that we call seizures. And they tell you, but everything was okay. And he has come in this group. So you could have two presentations. Those ones where there is something that happened, and those ones where they do not remember anything that happened. So these ones who don't have anything that happened at birth, they tend to come with complaints of delayed milestones. Not walking, not doing it, or preference. For example, you don't expect a baby before 1 year to be using only one hand.
Yeah, they should use one, transfer to the other. Perfect. Mouth, you know.
Yes, that. So if you're not seeing that activity, and the baby is preferring to use one side, that could be a sign that maybe my child
could be having a problem with the other side.
Yes.
Okay, so maybe before we go to the abnormalities, is it okay if we took our viewers through the different milestones? Because one will be like, if my child is not doing what is expected of a certain age, in other words, what is expected of a certain age as the child is growing, especially during their first year of life?
So usually the milestones that we talk about, and for our viewers, the milestones you'd want to know, I would call them the activities or the normal activities the baby is supposed to be performing or doing at a certain
age
group. For example, if we take, and we have we can call them 4, but detailed was even, we can talk about 5. But the 4 ones, and we talk about language, that is speaking, how a baby communicates. Then we have the gross motor, that is the walking, the crawling.
The way they are using their limbs mainly.
Yes, perfect. Then you have the fine motor, the way they are going to use
the touch.
The touch, those small things. And lastly is the social.
How they are interacting. Okay.
So for example, you expect a baby by around 6 months to 8 months, and he should be already crawling, or should be starting. If he has delayed, by around 7 months to 8 months, they should be crawling. Their parents will tell you, mine delays to crawl. But then you might take him to the upper and say, okay, by 8 max, you should be
crawling. So the red flag is hitting 9 months.
Yes.
And the child is not yet crawling.
Perfect. So if the child is not yet crawling at that time, then you start worrying and say, maybe there's a problem. Or at around, then you expect still that child to be, for example, trying to stand and walking on items. If he has finished, if he's not crawling on you, he has crawled, but you expect them to be moving on items around, touching furniture and moving around, which we call cruising. And if a baby by even 1 year
is not yet standing with support
and walking around
the house,
that could be a problem, and that could be a red flag.
And then sitting?
Then sitting, you expect a baby, that one is actually a lesser one. By around 5 months, 4 to 5, 6, babies should already be seated.
So when do we expect a red flag on that?
By 6 months, 6.5 months, and your baby is not sitting, and he only sits on your laps and he can't sit independently, then that is a red flag. Means it is a danger sign telling you that something is not happening normally.
So if my baby hits 7 months and they are not crawling, sitting on their own, I should get worried.
Yes,
I should visit the health worker.
Yes.
And then walking?
So the walking, usually it will depend. Usually in our setting, actually it is surprising that in our population, children walk
much
earlier.
Yes.
We do not know why this happens. However, they're theorizing and saying, look here, in your countries, people lack what to eat, so it's like a survival instinct. These children have to come and survive. Mother is carrying on the back. He has to go and dig, so this child has to survive.
I think we are stimulating our children very well of late.
Yes.
It used not to be like that in the past, but of late we are seeing children get to walk at 10 months.
Yeah, which is very nice. So the walking, we give a maximum of 1.5 years. That is 1 year and 6 months. If by 1 year and 6 months or 7 months, the baby is not walking, then that's a red flag. That is a worry that maybe I have a problem. And with cerebral palsy, since we said it's a disorder of what?
Of movement.
Movement and posture.
And posture.
So that's why we are drilling more on the aspect of movement.
Of movement.
Yes.
So many times I get parents complaining of my child is not speaking, my child is not speaking. I think our viewers out there would want to know, when is the child expected to speak?
So a baby speaking, and the speaking depends. We usually say, for example, in neurology, that within the first 2 years of life, the baby encodes and decodes. He has to take in, conceptualize that, and then he brings out. So there are many things that can
affect speech.
Affect speech. But if nothing is there and you want to know my baby is not speaking, and I get many of those ones who come in and they say my baby is not speaking, my baby is not doing this, but there are some things, that baby is supposed to stay cooing, those things when you want something from the mother.
At 2-3 months of age.
Then, by that time, then they will start actually they start to babble by around 9 months before they get the strange anxiety. Because also even vision is a sign of, say, I don't understand you, I don't get you.
Sure.
So, babbling, they have finished the cooing, the babbling, then they start getting some bit of verbs and the consonants come through. And by around 1 year, you expect a baby to start having at least a one-word sentence. Mama, Tata, Papa, by at least that 1 year. You should be saying one word. And it also, at least those ones should be coming through. But if they're not coming through, then you have to ask yourself, if the baby is okay, what's the problem? Is the baby alone at home? Are we using many languages? Did the mother delay to walk?
And I think that is a very serious issue because these days our parents out there get to work a lot. So they leave when the babies are sleeping and they come back when the babies are sleeping. So actually no one is there to stimulate the children's speech. And then even when they are home over the weekend, there is English. Then you find it is a multicultural family and there are everyone wants to bring through their language. I think families out there should come up with a common language to use.
Yeah, especially in these days where we have house managers and the parents, like you rightly said, are away. Then the daddy is away, and and if he comes in the different language, you can imagine.
So daddy comes with his language, then mommy comes, then auntie so and so who commonly visits over a weekend.
Yes.
And then the house manager also has her language. I get you.
Yeah, so that one can also at times affect some of the children, and making them fail to talk. But like we said, we expect some things that if that one is not the issue, we don't have issues. We expect at least 1 year, mama, tata, papa. By 1.5 years, at least he started putting up 2 words, mama, food, mama, this. By around 2 years, baby is already some very...
so by 2 years, they should have 2 word sentences.
Yes, that is, we go.
Mommy, come.
Yeah, the faster ones even can have 3. Mommy, come, sleep, at 2 years. But if at least he's bringing 2 word sentences by 2 years, you're not very worried? Yes.
Okay, so, thank you very, very much, Dr. Sebunya. So our viewers out there, like you've heard from the expert, at 5 months, your child is expected to be seated. That means if they reach their 7 months without sitting, there is a problem. At 6 to 7 months, they should be crawling. Reaching 9 months without crawling, there is a problem. At 8 to 1 year, they should be standing with support, moving around the house with support. If they reach 1 year without standing with support, then there is a problem. And by 1.5 years, your child should be walking solely on their feet. If they fail to achieve that, then there is a problem. For speech, if you realize that the child is not uttering any word by 1 year, then you need to think about, is my child hearing to begin with? Have I taken time to stimulate this child's speech? In other words, are you getting time to interact with a child and speak to them? What languages are we using in a family? Maybe you're using so many languages and you're confusing the child, and the child does not know which language to use. You are watching the Pediatric Voice, and you are watching Bethany TV for Health. We are hosting Dr. Sebunya Robert Kauye, who's a pediatric neurologist, and we are diving into cerebral palsy. Thank you for keeping it at Bethany TV. Please feel free to tune in to Bethany TV Uganda, that is on YouTube and Facebook, as well as Bethany TV on GoTV, channel 841 and channel 170 on free to air. Now, Dr. Sebunya, you've seen in the developed world, it is much less, about 1.8 to 2.3 cases per 1,000 live births. And in here, you've said the statistics is almost times 3, 5.8. I don't know whether those statistics are actually accurate, because I see it in my face. Almost on every village, there are like 5 families with a child with cerebral palsy, you know? Sometimes I feel the statistics are underrated actually in our setting. But what really makes our children develop cerebral palsy and less in the developed world? What are those risk factors to cerebral palsy?
So, you want to take cerebral palsy and the risk factors, you want to get that you have 2 cohorts, 2 groups of people with cerebral palsy. But we shall diverge into more of the group that we know that speaks to why the Western world has a bit lesser numbers as opposed to ours. And I can also totally agree with you. What I see, and when I go, for example, to outreaches, it is so phenomenal that what we report may not be, it may be just the tip of the iceberg. So
the question, are we hiding these kids, that the researchers are not meeting them? Because as a general pediatrician, on the day-to-day basis, they're in our face, they are there. When we go for community visits, they are there. So I'm actually surprised it is much less. The statistics are reporting that much less a prevalence in our setting.
2.7 to 5.8, not that a small number. That is per 1,000 live births. It's not that a small number. And when you compare it to the Western world, then definitely ours is like more than...
It is almost times 4 theirs.
Times 4 theirs. So what are the factors that usually are contributing to this? One of the things that I speak always to is that cerebral palsy, the commonest in our setting, is I usually tease my colleagues and tell them we have to have a gynecologist gynecologist is part of the team. And when we're discussing cerebral palsy, I wish you had brought in also
a gynecologist.
Next
time, doctor.
Next time. So because the causes could be first factors that are in the antenatal period, then perinatal period, and even postnatal period.
That is when the mother is still pregnant.
Yes.
During the delivery time.
Yes.
And post-delivery time. Okay.
And when the mother is pregnant, mothers not eating very well, mothers who have pre-existing conditions, I could say diseases like diabetes, thyroid disease, seizure disorder or epilepsy, those ones who have other chronic conditions and they do not know,
high blood
pressure. So that is the pregnancy. That's why it is imperative that when a mother conceives, it's supposed to be a planned pregnancy, so that they see their gynecologist regularly, so that they try to iron out those things. Because remember, during pregnancy, they could also unfortunately get preterm delivery.
Dr. Sebonya, you're talking about planning pregnancy.
Yes.
That is news in African setting.
I know.
How often we plan pregnancies?
I know. It is news in our African setting, but we have to bring this out. And it's not that common, for example, to go to my village and say that you have to plan pregnancy. It may not be possible, but if you become pregnant, I would recommend that you go.
So in other words, as soon as you miss your period,
perfect.
You go ahead and test and confirm that you're pregnant.
Yes.
You should visit the next gynecologist.
Yes, or a health worker who is competent in this field and helps you. For example, they will give you multivitamin, they will give them folic acid.
They will check you for the chronic
illnesses
and see if it is there and manage it.
If they are there and manage it so that they prevent those risk factors.
Thank you very much, Dr. Sebonya, for that submission. Thank you for keeping it at Bethany TV and watching the Pediatric Voice. We are having a discussion on cerebral palsy, and we were diving into the different risk factors for cerebral palsy. Please keep it at Bethany TV. Let's come back shortly after the break.
Bethany TV for Health. The Heroes in Health Awards here is back. Welcome to the 4th edition of the Heroes in Health Awards. The Heroes in Health Awards once again presents you an opportunity to celebrate your heroes in the health sector across Uganda under the theme Strategic Multi-Sectoral Partnerships to Transform the Health System and Workforce. Do you know an organization, innovation, or individual whom you admire for their professionalism, sacrifice, and impact in your community? Do they go above and beyond the ordinary call of their duty? Let us know about your hero. To nominate, visit www.hihawards.com. Nominations are now open until the 1st of October 2023. The Heroes in Health Awards 2023 is sponsored by the Ministry of Health in conjunction with Extraordinary Media with support from Bethany TV for Health. Growing and multiplying.
Father, we thank you that as we've joined our faith on this earth, whatever
touching those close and beyond, the word of God ministered, lives changed.
Our God made a way for the children of Israel and they made it to the promised land.
The day of salvation, and today is a day of freedom for you in Jesus' name. If you believe it, say amen.
We celebrate the resurrection because Jesus is alive.
It's a brand new day. Here we go, we say it's a brand new day.
Never miss the Watoto Sunday service every Sunday, 10 to 11:30 a.m. live on Bethany TV for Health. Bethany TV for Health.
Thank you for watching Bethany TV for Health. And today it is a Wednesday and we are on the Paediatric Voice, a show where we discuss the different childhood health issues, the different illnesses, and how best we can improve the livelihoods of our little ones to make sure that they grow to their full potential. I'm your usual host, Dr. Helen Namsoke. And today in our studio, we have Dr. Robert Sebunya-Kabuye, who is a pediatric neurologist at St. Francis Hospital in Zambia. And he's here to take us through cerebral palsy. We are discussing the different aspects of cerebral palsy, a common childhood health issue that is associated with disability and the different derangement of different aspects of a child's development. And before we broke up from the break, we were discussing the risk factors to cerebral palsy. But before we dive back into the discussion, you can watch us on GoTV channel 841 and free-to-air channel 170, on Facebook, YouTube, on Bethany TV Uganda, as well as on www.bethanytvuganda.org on X. Dr. Sebunya, we were discussing the risk factors, and you clearly told us that mothers should have proper antenatal care to prevent brain insult during pregnancy. So in other words, the different maternal conditions like diabetes, hypertension, sickle cell, maternal infections can actually cause cerebral palsy. What are the other risk factors apart from the maternal conditions?
So the other risk factors is when the baby is being born. From the time the baby is being born or still in the uterine, in the womb, the time when they are born, and it could be maternal infection. That still speaks to the fact that these mothers, when you know that you're pregnant, you go and see the gynecologist so that they treat any infection, because those infections can potentially move from the mother and go to the baby. And when they go to the baby, they will also affect the what?
The brain.
The baby's brain. So infections can cause that. The other one could be when the baby, for example, is being born. When the baby is being born and doesn't get enough oxygen, and that's the commonest thing that you usually see. One of the commonest causes of cerebral palsy that is that we see in many circumstances.
So what would make a baby not get enough oxygen?
So there are many factors that could cause a baby. If a mother, for example, if it's a big baby, and say, that's why I spoke to seeing the healthy workers and prepare even for delivery when you deliver from a hospital. So I would implore mothers who are pregnant to deliver from a hospital setting. And because if the baby, for example, is a big baby, then he goes and tries to push it, he won't pass through the birth canal. And whilst he struggles to pass through the birth canal, he doesn't get enough oxygen, and that one can, which we call obstructed labor, can potentially predispose this baby to cerebral palsy.
So that actually can explain why we have more cerebral palsy in our world as compared to, because a big chunk of our mothers actually, especially in the rural areas, deliver from home. Yes.
That's why I implore them that if where possible and you know that you're pregnant, you go and deliver from a healthy facility.
And actually, we have healthy facilities even to the almost parish level in this country. Yes. That is the health center 2s, then health center 3s at sub-county levels, health center 4s at the county levels, and district hospitals. So the government has done us so well that the facilities are brought as near to us as possible. Yeah, we can't fail to thank the government of the Republic of Uganda for that they've tried to bring the service delivery to the common man, to everyone. So it is imperative that when one becomes pregnant, at least it goes, because these healthy facilities will refer appropriately depending on what they can handle or what they can't handle. So that is one, when you don't get enough oxygen, and it's the commonest. The other one is many children who are delivered as preterm. For example, a mother is supposed to deliver a baby, say in, I would say in December. At 9 months.
At 9 months. And delivers, for example, this time, this is October, today is 4th of October, and delivers today. So he has had many weeks. So this baby is still a premature baby.
Almost 8 weeks before birth, before term.
Before term.
Almost 2 months.
Yes. And when that one happens, these babies who are not term are not, their brain is also not very mature. So these babies their brains can easily bleed, what we call they can easily get what we call intraventricular hemorrhage. They bleed within the walls of the brain, which we call the ventricles. Or if they don't get that, the way they get other infections, because when they have delivered prematurely, their also immune system is very
low.
So they are prone to getting infections, and which we call neonatal infections. And when they get them, these infections, we now know that they affect the development of the brain, especially the white matter pathways, by just having infections. So you can have infections intrauterine, but also when the baby is born. So those infections can be a problem. And I'm seeing a lot of infections, prematurity, and the lack of oxygen when the baby is being born. So usually it is imperative that we recommend, or every person sees a pregnant woman, actually should ask, where do you go? Not which mulelwa or healthy traditional birth attendant are you going to? Yes, they are useful and we can't run away from them in some other hard to reach areas, but if we can incorporate them as well, like in our village healthy teams, and we link them to in our service, and they can appropriately also refer these mothers to the health facilities on time, so that we don't get a brain that has lacked oxygen.
I'm seeing prolonged labor or prolonged pregnancy as a very big risk factor.
True.
And actually, when you look at the statistics, you find that the number 3 commonest cause of childhood mortality in Uganda is actually birth asphyxia. That is a condition whereby the child gets tired during their birth. Yes. So it means that a big chunk of our children go through this prolonged phase of labor and pregnancy. Some of them pass on. As you can see, it is the number 3 cause. Number 1 being prematurity, number 2 being infections, and number 3 being birth asphyxia. That is the brain getting tired during the childbirth process. And you see it is seriously impacting. For those that don't pass on, they live with serious lifelong issues. So dear viewers, I would encourage you that whenever you realize that you're pregnant, please feel free to visit a nearest health facility for you to be adequately assessed, and for you to make sure you deliver in a health facility so that you have a proper assessment of your newborn child and you have proper care, you have timely delivery to avoid your child's brain getting impacted or damaged. As for those that don't live with lifelong complications, baby's brain getting damaged is number 3 cause as to why we are losing our children in this country. It is a very common situation, children's brains getting damaged or getting tired during birth process, and that is birth asphyxia. Are there any other risk factors?
Yes. So one of the other risk factors, and it's very common, is what we call yellowing of eyes or jaundice. Kamuli. So in my local language they call it kamuli. Omwana afunye kamuli. So many a times this kamuli, people are told to go and sunbathe. Omwana mwanike mukasana, sunbathe the child. And that's not the proper way of doing it.
They don't even know how much you should sunbathe. Yes. And the question is, does it even work? So studies have shown it doesn't actually really work.
So that is also one of the risk factors of cerebral palsy. When you have any baby and you've seen that he has yellow eyes on day 1 of life, you ought to go and see a doctor or a healthy center or a specialist, so that they preferably measure those levels and actually help to decrease them by either putting the baby in that light, usually it's blue light, which we call phototherapy, or if it is even that severe, they can do exchange transfusion. And I remember vividly when Dr. Helen was doing exchange.
It used to be my favorite procedure.
Exchange transfusions.
Yes.
So that's also one of the other things that can predispose babies to having cerebral palsy. And the mothers will come and say, "Doctor, my child is not doing, I delivered normally." Because yes, the birth was normal, but they got these complications and they were just told to go and sunbathe.
On a sad note, it usually happens shortly after discharge.
Yes.
And I think that's why they are hesitant to come back to the facility, because they've just left the hospital. Because according to Ugandan setting, normal births we usually discharge them after 24 hours post-delivery. And cesarean mothers are discharged 72 hours post-delivery. So just imagine you had a Caesar, you just reached home, and then here you are, the baby is yellow. You have to bounce back to hospital. And let me report our parents out there, Dr. Sebunya. They often tell us, "I don't care what is happening with this child, me, I'm not getting admitted again." You know, but with proper counseling, some of them accept.
Yeah, so actually, I think they've gone through a lot. The process of delivery and all that goes around it is not that an easy process. But if you calculate and you inform the mother that, you look here, this child is going to be having this disorder of movement and posture. Mothers come and tell me, "Doctor, my child ever walk?" And I tell them the answers are not that clear cut. We have to do all these exercises and do this, because he or she must have failed to be admitted because the child had yellow eyes, and then this yellowing went and affected the brain. So that's another common problem that causes cerebral palsy. And just because we are running short of time, we could have other causes, even trauma, birth trauma. If a baby suddenly falls down during the birth process and affects the brain.
Or the delivery is so difficult.
Yes, all that. And you have, for example, this extraction, and you affect the...
You use instruments to deliver the baby.
And then the baby comes out, especially big babies, then instrumental delivery. Those ones can potentially also predispose to cerebral palsy.
Thank you very much.
That there are other whereby there is nothing, the other cohort whereby nothing happened and could be genetic, whereby it comes from what I usually call disorders of development of the brain, which are neuromigration disorders. The brain forms in many different stages, but at times these stages may not occur properly. And the baby is born normally, cried immediately, and everything was okay, but my baby is not doing like this. Also, those genetic conditions that predispose to not the brain developing very well can potentially give you cerebral palsy.
Okay, thank you very much, Dr. Sebunya. Now, this condition called cerebral palsy, is it preventable?
Definitely, we've been talking about how we can prevent it, and one of the ways of preventing it is the risk factors we've talked about. I would say hospital, when you are pregnant, doing what the doctors are telling you to do. And then if I've had parents and the baby is very big and the doctors recommend a cesarean section, and either the mother-in-law or somebody says, "No, you have to push, you can't do this," and they are outpowered. I usually call them the very strong, powerful people behind the mothers-in-laws. And then this girl pushes, and actually the baby can't pass through the birth canal, and they get that. So
theory has it that in African society, the public actually thinks if a mother does not push a baby, she's not strong enough as a mother. But I can assure you, dear viewers, a cesarean section is a major operation, and it is the only operation where a mother is expected to come out of theater and still remain strong, continue breastfeeding her baby and all that. I wish you can only know the different layers of the skin one has to go through to reach a baby. So stop disregarding mothers that have had cesarean section as not strong mothers. They're actually stronger than those.
Mothers.
They are stronger than those that have had a normal delivery.
I agree, they are strong mothers.
Yes.
Yes.
And I think that's why people are hesitant to accept a cesarean section in our society.
It's a safe delivery if it is appropriately
chosen. So in other words, it should be a discussion between a health worker,
yes,
and a parent or a family, and most likely guided by a health worker.
Guided by a health worker, depending on how the baby is and
or the mother's condition.
Mother's condition. Yes.
Okay, so Dr. Sebunya, can this thing be treated, called cerebral palsy? Is it treatable, one? And when it is treatable, if it is treatable, is it curable? Is there something you can do about this child once they have cerebral palsy?
So I always get that question, and my answer is that cerebral palsy, currently do not have medicine that we give a child and is treated completely and is improved. There are talks of people doing now stem cell transplant, that they are going to India to do stem cell transplant.
Yeah, we see those ads asking for money.
Let me take this opportunity also to dispel that the current position of the International Child Neurology Society is very clear that we do not have enough evidence to recommend this in our clinical setting. People are doing these clinical trials, but the data that is coming through is not yet very strong enough to convince us that we do stem cell transplantation to treat cerebral palsy. However, what do? Our goals in management of cerebral palsy is to improve function, so that somebody who has cerebral palsy can function as near as a normal person as possible, but we are not curing it. And as such, it is more of a multidisciplinary team approach, whereby
I remember very well in your definition, you say there is an irreversible damage to the brain.
Thank you so much.
So you can't reverse
the
insult that happens to the brain.
Yes.
But you can improve the functionality of the brain.
I agree with you.
Good, thank you.
So, as such, you need a mild attitude of team that you are going to work with. You might need a physiotherapist, people who do exercises. You need an occupational therapy to optimize the function. You need a neurologist, a social worker, an orthopedic surgeon. Because these babies or children with cerebral palsy tend to get structural problems, say with the bones, if they are bending, which you call scoliosis, or they have contractures that are better managed by the orthopedic surgeons. They need a dietitian, somebody to help with the diet. Because I get many of them telling me, doctor, my child is not gaining weight, and yet he's eating very well, but what is the quality of eating? Does the child choke when he's eating? How long does it take for them to eat? What happens? Does he cry on feeding? So usually I tell people, my approach in management of cerebral palsy, I usually want it to manage it from head to toe, because it is a disorder of movement and posture, and it is a multitude. There are many things that come through. So in a nutshell, you'd want to look at when a child comes to you, you want to see, you want to screen out the other related problems, which we call comorbidities. And common, like I said in the definition, some may present with epilepsy. So any child who has movements that want to mimic seizure disorder, convulsions, you'll want to go and do, say, an EEG to say, are they seizures or not seizures? And I have to mention it here to our viewers that not every child who has cerebral palsy and gets some abnormal movements has convulsions. Have convulsions.
Yes.
That is one. And not to mention that those ones who get their cerebral palsy secondary to jaundice, they get a lot because of the area of the brain that coordinates movement, that governs our body movements, was affected. They tend to get a lot of jerking.
Yeah.
And when they get that jerking, many interpret it as
a convulsion. Which is not true.
Which is not true. So, but what I'm saying, if there are other things that somebody has cerebral palsy and they want to mimic convulsions, you want to do an EEG to see, are they convulsions
or not.
The other thing, like I said, from head to toe, you want to look at the eyes. In a child who has cerebral palsy, you want to make sure, are they seeing? Because remember, even the brain, we see the wiring of our eyes also goes to the back of the brain. So if there was no enough oxygen, these wires may also have not been spared. So you want to see, are they seeing? Many times I tell the parent that he's not seeing and say, but doctor, I thought he was seeing because he's doing like this, but at times he may not seeing, which we call cortical blindness.
Blindness, yes.
Then the other thing is, are they hearing? They may not be hearing. That is, you are only touching the face.
Especially those who suffered jaundice.
Yes, especially those ones who had yellowing of eyes, who suffered jaundice. Are they hearing? So you want also to assess that hearing. So that is one. Then you move down and say, how is the swallowing? Does he choke while feeding? Doctor is not gaining weight. Why are we? Does he? I'm giving him frequent feeds like you told me, but he's not gaining weight. He's bringing back things. I don't know what to do. And the mother is doing their best, but the child is not gaining weight. So some of them, even the metabolic, they have what we call silent aspiration, that some things are going to the lungs, especially those ones who come through and the baby is having frequent chest infections. Tells you, doctor, my child is having chest infections, pneumonia every time. Then you want to know, how is the feeding? How is this happening? Does he choke while feeding? Does he get all this? So that one may tell you indirectly that you may have to assess the safety of feeding so that these things don't continue going into the lungs to cause these frequent chest infections and poor weight poor weight gain. So
talking about feeding, sometimes we've had to encourage families to go in for a PEG, a percutaneous enterogastro feeding. And mothers out there are so scared about it. Maybe you can have a comment about it.
Mothers out there and viewers out there, a PEG, or I will call it in a simple language, it's like a tube we put on the tummy. And that tube you can put in, the doctors put it in and it goes directly to the stomach. It is safe when it is put in the right way, and helps to nourish the baby. Remember, now you have been struggling with the baby who is vomiting things they are eating. Some are going to the lungs, but here you know that they are going straight to the what? To the tummy. To the tummy.
And so actually, I think it is going to help their child live longer. One time we had a child, about 6 years. He was getting frequent chest infections. And on top of that, his seizures were hard to control, because he kept on aspirating following the chest infections. Then the seizures became seizures and seizures and seizures. And advising the mother to accept a PEG was another story.
Yeah, I know in our setting and in our culture, it's not something people are used to seeing tubes.
Food going through the
nose.
And yet we can't keep a child, because cerebral palsy is going to be there for long, with a nasogastric
tube. So I would encourage them that if, for example, you come to a doctor and the doctor recommends that this baby might need a feeding tube and this tube is going to be put here, please accept. In other centers, in our setting, because of the resources, we just use the signs. The baby is not gaining weight, he's coughing while feeding, he has poor, and he is also having poor weight gain. So what we usually do is we recommend a PEG, but others even do studies, which we call barium studies, to see what is happening, and they put their PEG. PEGs are good. Those ones who have done them will testify. I have many who have testified, and initially they never wanted them, but now they come and say, doctor, thank you. I think
because
I have
my child is gaining weight and is having less infections.
Yes.
Okay, Dr. Sebunya, in a minute, as you can see, these children are struggling, and imagine having a child who cannot help themselves. They need to be fed, everything, they need to be helped, bowel management and all that. Can a mother really work with such a child? It's usually very difficult and very stressful to a family, devastating in caring for these children. Are there centers that can help in caring for these children so that a mother out there can continue with their day-to-day activities and be productive to the family, as well as taking care of their child?
Yes, there are some centers, but the unfortunate thing that they are all for paying. Most of them have been set up by individuals. There are few government institutions. So, and that is also because we have this World Cerebral Palsy that is coming through on the 6th.
On the 6th.
If we could also get more centers that care for these children, because these mothers have to fend for the families. And just to say one thing is that still in our setting, I wanted to bring this to mention, is that people still think cerebral palsy is spiritual, it is biological, and you end up finding that most of these mothers who have children with cerebral palsy are either single parents, either their spouses or have left them and they are struggling alone. He has to fend for the child. He has to get somebody to help them if they can't take them to school. They are not powered enough financially to take them to a center that cares for them. Remember, these other services that I've said that it is a multidisciplinary kind of management are also not free of charge. So there is a lot. So to prevent all this multitude of things, I think our commonest problem is the lack of oxygen and the gain and delivering from
So it
the
is
hospital
better to prevent it
than having it.
Thank you
Yes.
very much, Dr. Sebunya, and thank you for coming into the Pediatric Voice to teach our viewers out there about cerebral palsy. That is it we heard from our guest this week. And on the Pediatric Voice, we have had a discussion on cerebral palsy, and one key point I've clearly picked that we need different stakeholders to come out and help us. What thing you need to know that cerebral palsy is with us, it is there in our setting, or at least on every village there is a child suffering cerebral palsy. And this has greatly affected the productivity of the nation, as so many mothers are missing out on the boardroom because they have to stay home and take care of their incapacitated child. In other words, if we would have centers, maybe daycare centers, where a parent would drop their child and make sure that they have good care and they can comfortably go and serve the nation and be productive, that would be very, very helpful. That is it we had this week on the Pediatric Voice. I'm your host, Dr. Helen Namsoke. Till we meet next time, keep watching Bethany TV for health.